Hello everyone, in this video we'll be reviewing smoking cessation. General information. Providers must inquire about tobacco use. They must provide the 1-800-QUIT-NOW number. Counseling is just as important as medications. Combination treatment can be used as first line. Medications are always recommended unless contraindicated. E-cigs should not be recommended. Counsel all pregnant women, children, and light smokers. Smokers 19 to 64 years old need the flu shot along with the Pneumovax 23 vaccines. Smoke inducers, SIP 45812, could create supratherapeutic levels of medication, so it's important to look out for which medications they're taking. And any woman older than 35 years old should not be taking any oral contraceptives when smoking. We want to follow the 5A's model, which is ask about tobacco use, advise to quit, assess willingness to quit, assist in quit attempt, and arrange a follow up. The main medications will be counseling on and the patients will be taking are nicotine patches, known as Nicoderm CQ, nicotine gum, known as Nicorette, and nicotine lozenges, known as Nicorette Mini. For nicotine replacement treatment, these are mostly over the counter. You want to wait 15 minutes after eating or drinking for use. ADRs include headache, dizziness, insomnia, and nervousness. The patch could create vivid dreams, and the nicotine inhaler could create a throat irritation. You want to avoid in patients who recently had a heart attack, any arrhythmias, angina, and pregnancy. Some notes to take into consideration is they must be 18 years or older, so you need to ask for ID to purchase. These could be used in combination with short acting, and these are the most effective medications. You're going to remove the patch before any MRIs, and for the gum and lozenges, they have been shown to also help with weight loss. Other medications include Bupropion SR, brand name Zyban, not to be confused with Wellbutrin, which is another formulation of bupropion. The mechanism of action is it is a dopamine and norepinephrine blocker. ADRs include dry mouth, insomnia, agitation, and headache. You want to watch out for any suicide behavior in younger patients. Contraindications include any patients with seizure disorders, anorexia, bulimia, taking any MAOIs in the last 14 days, and any patients on benzodiazepines or barbiturates. Things to consider are you do not want to combine this with any other form of bupropion. Start 1 week before quitting smoking. Max dose of 300 milligrams per day, and wait 8 hours if splitting doses. We also have Varenicline, also known as Chantix, which is an alpha 4 beta 2 nicotinic agonist. ADRs include insomnia, nausea, abnormal dreams, and headache. Black box warning for any serious psychiatric behavior, any seizures, an increase in alcohol, and for sleepwalking. And contraindications include any patients that are unable to quit immediately. They should be cutting smoking by 50% every 4 weeks. Some things to take into consideration is to start 1 week before quitting, quit date, or start and quit between 8 to 35 days. Take after meals with a tall glass of water. You want to decrease alcohol use and caution with serious reactions. Now, when counseling for the nicotine replacement, it's important to keep some things into consideration for the nicotine patch. For counseling, you want to apply a new patch start of each day, disposed of the used pouch, apply to clean, dry, hairless skin, and hold for 10 seconds. Wear the patch for 24 hours and only remove before sleep if you have abnormal dreams. Fold inward and discard in pouch and place it in the trash. You want to hot wash your hands before and after use. Rotate the site of the patch and never cut the patch or use more than one patch at the same time. Now, it's important to assess how much the patient is smoking. If they're smoking more than 10 cigarettes a day, you want to start off with the 21 milligram patch. If they are smoking less than 10 cigarettes a day, you want to start off with the 14 milligram patch. For the nicotine gum, you want to chew slowly till you feel the tingle or flavored taste. Then park the gum in your cheek and use for 30 minutes and use one piece every 1 to 2 hours. No more than 24 pieces per day. And for the nicotine lozenges, you want to place it in your mouth and let it dissolve slowly. Move to side every 5 minutes for up to 20 to 30 minutes. And never use more than one lozenge at a time. And for lozenges, no more than 20 lozenges per day. And for these, it's important to note when the patient smokes. If they smoke more than 30 minutes after waking, you want to start at a dose of 2 milligrams. If they smoke less than 30 minutes after waking, you want to start at 4 milligrams. And for weeks 1 to 6, you want one piece every 1 to 2 hours. Then weeks 7 to 9, one piece every 2 to 4 hours. Then weeks 10 to 12, one piece every 4 to 8 hours. Other options include the nicotine inhaler and nicotine nasal spray, but these are not commonly used and are not usually available over the counter. And that's it. That's all we have for smoking cessation. I hope you enjoyed this video. Please like and subscribe for more, and I'll see you in the next video.